Hi, folks. In this module, my co-host and I will be talking about how to maintain partnerships and communicate well throughout a pragmatic trial.
And that word maintain is doing a lot of work here because starting a partnership is one thing. Keeping it alive, useful, respectful, and not completely buried under calendar invites is another thing entirely.
Exactly. In the last module, we talked about engaging partners and building partnerships. The key message was that pragmatic trials can't be designed in isolation. Patients, caregivers, providers, health system leaders, community partners, policymakers, and others all bring expertise that can shape the trial.
And today we are building on that. Once people are at the table, how do we keep them meaningfully involved? How do we communicate in a way that builds trust instead of draining everyone's inbox? And how do we keep the partnership going when the trial gets busy, messy, delayed, or all three at once?
Which, let's be honest, isn't rare.
Not rare at all. If your trial timeline has never shifted, either congratulations or check again.
So let's start with the basic idea. A partnership isn't maintained by one kickoff meeting, one advisory group photo, and one newsletter 6 months later saying, "Great news, recruitment is ongoing."
That is more like a postcard from the trial team.
Right. Maintaining a partnership means keeping people informed, inviting input at the right moments, responding to concerns, recognizing contributions, and showing partners that their involvement continues to matter.
The goal isn't to communicate constantly. Nobody needs 27 updates about the same ethics amendment. The goal is to communicate clearly, respectfully, and usefully.
That is a good distinction. More communication isn't always better communication.
Absolutely. Sometimes more communication is just noise wearing a blazer.
So the first practical step is setting expectations early. Before the trial is fully underway, partners should understand what their role is, what decisions they can influence, how often they will hear from the trial team, and what kinds of input are being requested.
This is where teams often get into trouble. They say, "We want your input," but they don't explain what that means. Are partners helping shape recruitment materials, reviewing participant-facing documents, advising on clinic workflow, troubleshooting implementation, helping interpret findings? All of the above?
And equally important, what isn't open for change? There may be regulatory requirements, funding constraints, ethics approvals, data limitations, or scientific decisions that can't easily be modified.
That isn't a problem as long as people are told honestly. Partners don't expect unlimited influence, but they do expect clarity.
A useful phrase is, "Here are the decisions where your input can directly shape the study, and here are the areas where we have less flexibility."
That one sentence can prevent a lot of frustration later.
The second step is agreeing on how communication will happen. That sounds boring, but it matters. Do people prefer email, short meetings, phone calls, a shared document, text reminders, a newsletter, a standing advisory group?
And the answer may differ by partner group. A provider partner may want a 5-minute update before clinic. A community partner may prefer a short phone call. A patient partner may want materials sent in advance so they have time to think. A health system leader may want a concise one-page summary with the main implications.
This is where communication needs to be designed around the audience, not around what is easiest for the research team.
Which hurts a little because what is easiest for the research team is usually a long email with 3 attachments and a sentence that says, "Please review at your earliest convenience."
A sentence that has never made anyone excited.
Never.
For partners, especially those outside research, long technical updates can create distance. They may feel like the trial is happening somewhere else, in a language they weren't invited to speak.
So plain language matters, and plain language doesn't mean dumbing things down. It means making the message easy to understand without making people work too hard.
A good communication update answers 4 simple questions. What happened? Why does it matter? What do we need from you? And what happens next?
That is the whole recipe. If an update doesn't answer those questions, it probably needs another pass.
Let's talk about one-way versus two-way communication. One-way communication is when the trial team sends information out. Newsletters, progress reports, meeting summaries, recruitment updates, and thank you notes can all be useful.
But they are mostly broadcast tools. They tell people what is happening. They don't automatically create engagement.
Two-way communication invites response. It asks partners what they think, what they are seeing, what barriers are showing up, and whether planned approaches make sense in real life.
For example, instead of saying, "We have revised the recruitment flyer," you might say, "We have revised the recruitment flyer. Does the language feel clear? Is anything missing? Would this make sense to patients in your setting?"
That small shift changes the tone. It says, you aren't just receiving information. You are helping shape it.
And this is especially important in pragmatic trials because so much depends on real-world fit. A recruitment plan that looks perfect in a protocol can fall apart in a busy clinic. A follow-up process that seems simple to researchers may be unrealistic for participants. A data collection form that looks harmless may create extra work for staff.
Partners can see those problems early, but only if the team creates space for honest input.
And honest input requires trust. People need to believe they can raise a concern without being dismissed as negative, difficult, or not understanding the study.
That is a major point. Good partnership communication isn't just cheerful updates. It also includes making room for discomfort.
Exactly. If a provider says, "This workflow isn't going to work," that isn't sabotage. That is a gift. It is much better to hear that before launch than after 3 sites quietly stop using the intervention.
Same with patient partners. If they say the consent form is confusing, or the visit schedule feels burdensome, or the language doesn't sound like how people actually talk, that feedback may improve recruitment, retention, and trust.
The trick is closing the loop.
Yes, closing the loop means telling partners what happened after they gave input.
And this is where many teams stumble. They ask for feedback, receive thoughtful comments, and then disappear into the research cave.
The research cave is very real.
It has coffee, spreadsheets, and a strange number of files named Final version 3.
But from the partner's perspective, silence can feel like their input went nowhere.
So after input is received, say what changed. You suggested simplifying the recruitment letter, so we shortened it and added a clearer explanation of what participation involves. Or, you raised concerns about transportation, so we added reimbursement information to the participant materials.
And if input can't be used, say that too, respectfully.
Something like, "We couldn't make that change because it conflicts with the approved protocol, but we will track this issue and consider it in the next amendment." That is much better than silence.
Partners don't need every suggestion accepted, but they do need to know their input was taken seriously.
Let's move to communication rhythm. Every trial needs some kind of communication plan. It doesn't have to be fancy. It can be a simple table that says who needs to hear what, how often, from whom, and through what channel.
For example, patient partners might meet monthly during design, then quarterly during recruitment, with ad hoc check-ins when participant materials change. Site staff might receive short monthly updates during recruitment and faster alerts when procedures change. Health system leaders might receive quarterly summaries focused on milestones, barriers, and decisions needed.
The communication plan should also change by phase. During planning, communication is usually more frequent because the trial is still being shaped. During implementation, communication needs to support problem solving. During analysis and dissemination, communication should help partners understand and share the findings.
And there is one major warning. Don't go quiet during the middle of the trial.
That is when teams are busy. Recruitment is happening, sites are asking questions, data issues are popping up, and everyone is trying to keep the machine running.
But from the outside, silence can look like the partnership has ended.
Even a brief update helps. Here's where we are. Here's what is going well. Here's what we are watching. Here's where we may need your input next. That can keep people connected.
And when things aren't going well, communication becomes even more important.
This is where transparency earns its keep. If recruitment is slow, say so. If a site is struggling, say so in a constructive way. If a planned process isn't working, bring partners into the problem solving.
There is a respectful way to do this. The goal isn't to panic everyone or blame anyone. The goal is to share enough information so partners can help.
For example, recruitment is lower than expected among older adults. We would like to understand whether our outreach approach, visit schedule, or materials may be creating barriers. That invites useful input.
Compare that with, recruitment is behind. Please recruit more. Less useful.
Also less inspiring.
Another important area is recognizing contributions. Maintaining partnerships isn't only about asking for help, it is also about appreciation.
And appreciation should be specific. Thank you for your input is fine, but your suggestion helped us make the survey easier to complete is better.
Recognition can include payment, authorship when appropriate, acknowledgments, thank you letters, certificates, invitations to present findings, or simply making sure partners see the effect of their work.
And don't save all appreciation for the end. A trial can run for years. People need to know along the way that their time matters.
Now let's talk about sustaining motivation. In long trials, enthusiasm naturally rises and falls. At the beginning, everyone is energized. The launch meeting feels exciting, the aims are clear, the coffee may even be decent.
A true sign of institutional commitment.
Then the trial enters the long middle. Recruitment is slower than hoped. Data cleaning is less glamorous than expected. People change jobs. Meetings start to feel repetitive.
This is where partnerships need care. Keep meetings purposeful. Share small wins. Show progress. Make space for partner stories. Ask whether the current communication format is still working.
And don't hold meetings just because they're on the calendar. If there's no meaningful reason to meet, send a short update instead. Respecting people's time builds trust.
On the other hand, don't cancel every meeting for 6 months and then suddenly ask partners to urgently review a document by Friday.
That isn't partnership. That is a surprise homework assignment.
Exactly.
Another challenge is turnover. In pragmatic trials, partnerships often depend on champions. A clinic lead, patient advisor, community contact, or health system partner may be central to keeping things moving.
But people move roles. They retire. They take new jobs. They go on leave. Sometimes they simply get overloaded.
So the trial team needs a continuity plan. That means documenting key decisions, keeping onboarding materials, having more than one contact when possible, and checking periodically whether the right people are still at the table.
One practical question to ask partners is, who else should understand this project in case your role changes? That is a simple way to reduce dependence on one person.
And when someone new joins, don't expect them to absorb 2 years of trial history from a shared folder with 400 files.
Please don't. That is how goodwill goes to die.
Create a short onboarding package. What is the trial? Why does it matter? What decisions have already been made? What is the partner's role? What is coming next?
That helps new partners contribute faster and prevents the group from having the same conversation again and again.
Let's also talk about disagreement. Partnerships aren't always smooth. Partners may have different priorities. A patient partner may want less participant burden. A provider may worry about clinic flow. A health system leader may focus on scalability. A researcher may be focused on preserving the scientific question.
None of those priorities are wrong. They are just different.
Good communication helps make those trade-offs visible. Instead of pretending everyone agrees, name the tension. We are trying to balance participant convenience with the need for complete outcome data. Or, we hear that this procedure may be difficult for sites, and we need to understand whether there is a simpler way to collect the same information.
That kind of language keeps the conversation focused on solving the problem, not defending positions.
And when a decision is made, explain why. Partners may not love every decision, but they are more likely to stay engaged if the reasoning is clear.
This brings us to inclusivity. Communication can either widen participation or quietly narrow it.
For example, meetings scheduled only during business hours may exclude some patient or caregiver partners. Materials only in English may exclude important communities. Heavy research language may exclude people who have valuable experience but don't speak in academic terms.
Accessibility matters too. Are materials readable? Are virtual meetings easy to join? Are captions available? Can people contribute in writing if they aren't comfortable speaking in a large group?
Inclusive communication means asking, not assuming. What would make it easier for you to participate is a simple but powerful question.
And then, importantly, act on the answer where possible.
Before we wrap up, let's give a simple structure teams can use.
First, set expectations. Be clear about roles, decision points, timelines, and limits.
Second, choose communication methods that fit the partner group. Don't assume one format works for everyone.
Third, keep communication two-way. Updates are useful, but partnership requires listening.
Fourth, close the loop. Show what changed because of partner input, or explain why something couldn't change.
Fifth, plan for the hard stuff: slow recruitment, disagreement, shifting priorities, and turnover.
And sixth, recognize contributions throughout the trial, not just at the end.
The big message is that partnership maintenance isn't extra decoration around the trial. It is part of how pragmatic trials work well in real-world settings.
Because pragmatic trials aren't only testing whether an intervention works. They are testing whether it works in the world people actually live and work in.
And the people who live and work in that world need to be more than names on a slide. They need to be informed, respected, and meaningfully involved.
So if there is one takeaway from this episode, it is this. Don't treat communication as a task to check off. Treat it as the way the partnership breathes.
Nicely said.
Thank you. I was proud of that one.
You should be.
Maintaining partnerships takes planning, humility, flexibility, and follow-through. But the payoff is real. Strong communication helps partners stay engaged, helps teams catch problems early, and helps the trial produce findings that people are more likely to understand, trust, and use.
And that is the whole point. Not just doing a trial, but doing a trial that matters to the people it is meant to serve.
Thanks for listening. For more content like this, please like and subscribe to our channel.